Okay, so Farron and we actually met at, she works at UTC, which is University of Tennessee, Chattanooga, in the School of Nursing there. And we met at a conference they were hosting, having it. So we met 2016, I think,
That's
16.
right.
And yes, so we connected and collaborated. So she is running the PowerPoint, so I'm not going to push on this computer.
All right. Thank you so much, Dr. Christman. And just like Rhonda said, we met back in 2016 at a conference around health equity and what that means for our community and local application. Oh, can you hear me okay?
Can y'all hear okay? Yes. Okay. Yep.
Okay, great. And what that means for local application. And we have a shared heart for that. And we've been working on various community partnerships and where we can share in service ever since our communities overlap in the Chattanooga region. And one way that we have done that is through the Minority Health Fair. If you don't know and you're not from this region, I just want to provide a little bit of background about why this work is so important. Chattanooga is a designated medically underserved area from a federal perspective. It's also a healthcare provider shortage area. Here, not just Hamilton County, but the 10 surrounding counties as well, where Hamilton County is the hub, and even the hub is considered medically underserved. So there's a huge need. And here in the southern United States, residents face poorer health outcomes than when compared to other residents across the country. And then if you drill down a little bit deeper, the disparities, even in these underserved communities, are exacerbated when you account for all variables by race and ethnicity. So the racial and ethnic health disparities that exist in this region are profound and evident in every measure of health, even when other variables are accounted for. We know that due to contextual historical reasons in the South, access to resources, access to insurance, there are all kinds of barriers to healthcare. And particularly Black Americans in Hamilton County have higher mortality rates due to diabetes, heart disease, stroke, cancer compared to the white residents. This is also true for those in rural areas as well. So if you're in a designated rural area outside of Hamilton County, you're also more likely to die from the top 5 leading causes of death and have a higher mortality rate for all leading causes of death, along with people of color here in the county. So to drill down why we need something called a minority health fair, it is these health disparities for Black residents compared to white residents are well known, and this is just a picture of what that looks like in Chattanooga. This data is from 2019, but even more recent data is very similar. You can see everything where it says ×4, it means 4 times more likely a Black person than someone who identifies as white to have hypertension, twice as likely for kidney disease, 34% more likely for diabetes. So you can see all of these health disparities. So what are we going to do about this as colleges of nursing, as people who want to see these disparities erased and to raise health outcomes across our counties in general, is that we're partnering with folks in our area who already have trusted networks and trusted relationships in communities where these health disparities exist. And one of those partners is the Minority Health Fair of Chattanooga. Their mission is to address healthcare of underserved communities. That's not just for Black residents, but anyone who's considered medically underserved, with an emphasis on our Black residents and people of color in Chattanooga. And to create more healthy and sustainable Chattanooga, they've also introduced translators, and this has been going on for 25 years. The attendance spans from about 600 to 6,000, depending on the year. And in 2026, just due to some branding and terminology changes, negative connotations with minority, the name is now changed to the Chattanooga Wellness Expo. And so this is what we're going to talk about as our community partner today. And I'll let Rhonda tell you a little more about how she got plugged into the Minority Health Fair Network.
So I attended one of the conferences that Farron's that they put on, and Chris was one of the speakers. Chris Ramsey, he's in the picture there, and he was talking about all the Minority Health Fair, all the things they're doing. He grew up in the inner city area in a poor home, and he wanted to do something to help the community. And so this was something that he wanted to do, right? Farron, correct me if I'm wrong.
Yes.
And so then he got together people, and in Hamilton County, students have to have a physical before they can go to school, before they start school. They have to have a signed doctor's slip. And so kids, it was a hardship on the parents, to take them when they don't have insurance to go to the doctor. So he started having, so that's what this is. They have doctors, nurse practitioners, providers come so they could see the children and they could get their physical form signed. It's just one of the things you have to have in Hamilton County. And so he was sharing this at the conference, and I waited in the long line. And at the end, I'm like, this is fascinating. I says, are you doing research on this? Are you collecting any data? He's like, no, but that's a really good idea. I'm like, I'm your girl. And I am a Google girl. I'm a research girl. And I love collecting. I'm a data junkie. And so anyway, so we collaborated. We got IRB here at Southern. And then we connect, with Farron, we all joined in together. So Farron was, I think, 2018 ish, right in there, I think, was when I met Chris at the conference, and it's in the spring and February of every year. They have a cultural disparity conference, and he does this every year. He has this Minority Health Fair. It's the first Sabbath in August, so that way the kids can get their physical before school starts, like the middle of August. And
yeah. Oh, go ahead, Ron. Sorry. I was going to chime in that the Black fraternities that Chris Ramsey was a part of were the starters of this, and then expanded with the programming to include the Black sororities. So the Kappas and the Deltas, if you're familiar with those sororities, have been instrumental in the founding of this organization.
And Chris was just such a, I might have a moment here. He passed away during COVID. And so his legacy continues, and they still do it every year, and it's just been a good thing. So go ahead, next slide. So what we do, there are providers that come from all over Chattanooga. He gets all kinds of, doctors, nurses, nurse practitioners, anyone who wants to come, and we do. They do screenings, and they get the mammogram bus, and you can set, he is a wonderful influencer and gets people bought in. So my first year I attended, I was the water girl. And so I just passed out water to the vendors and, the attendees. And because we didn't have IRB approval the first year, it was a little bit of a process. And so anyways, but they do checks. So Farron at UTC, they bring their nursing students, their nurse practitioners. I've taken Southern students, and we're setting up chairs, we're setting up tables. We rent, the Minority Health Fair, we rent the old Eastgate Mall that's downtown. And so we would put tables along, so we had a big X or big rectangle around the center part of the mall, and they just come through and they can get all the resources. I took a whole bunch of Steps to Christ one year and just set them up in Bible. It's a table. Everyone takes free stuff. So anyways, so there's over 600 have been served. There are just so many people that are blessed, and it's free. They can come in, they get free care. So the purpose, this case study, oh, no, you're doing that. No, I'm doing that.
Oh, you can go ahead.
Okay, how a university and community nonprofit partnership model based on community need, respect, accessibility, skill set, resources, personality, and solutions impacts nurse practitioner education and community health. And we also, I looked at the attendees' perceptions where Farron, they were looking at the nurse practitioner students. What's their takeaway here? They're students in their training, and to come and to get to have this lived experience at the health fair, provide health care to these people. And so it was interesting. So we finally did get IRB approval, talk about later, but taking around QR codes, people can, get the QR code and participate on their devices. All right, next slide. Or anything else on that, Farron?
No, that's it. Just starting out, and I want to be mindful of our time, so I'll speed through some of these. Is that we want to recognize these disparities, and we want to recognize the ways in which we can plug in. That's not taking the lead as an institution, plopping down in a neighborhood and saying we're here, aren't we doing good things? But to take instead the Chattanooga Expo, historically minority health fairs, lead and see, okay, what do you need? How can we help? Where can we plug in? And Rhonda's exactly right. We've gone in with students and provide health screenings at UTC. That's opened the door also for Southern students, nursing students to come in and do that as well. I'll show up to an event and Rhonda will be there with her students, we'll be there with ours, and we'll be working collaboratively to provide these screenings. So our methodology, again, there were two angles we were looking at, because you often hear the narrative that, oh, we're helping the community so much. But what we don't understand is sometimes when we participate in these events, we're also helping the students. We're helping the students be better practice ready and better prepared. And so I assessed the student perspective, Rhonda assessed the attendee health fair perspective. We did 2 anonymous surveys. One was to our NP alum, all who participated in many minority health fair experiences. And then one was to actually send surveys or on the spot get surveys and impressions from attendees. I have about 33% of our graduates responded to the survey, not bad for a survey response. And we had about 68 health fair attendees from 2021 through 2025 respond. Majority attendees were women, majority of respondees were Black. The data analysis used descriptive analysis to report the outcomes, the project's ongoing. We want to make sure that our partnerships are always mutual. So these arrows go 2 ways, that you can't go in with that top-down perspective, but you have to respect what the nonprofit brings to the table. And the fact that this is run by historically Black fraternities and sororities is crucial, because they have the trust for the Black community to actually show up. And frankly, most universities don't. We're building on that. We're working on that. But that's why that mutual respect and those mutually identified needs and solutions are so integral to success in a partnership, and why it's ongoing. We follow their lead. Here are what we do for the health screenings. We have about 100 to 330 free health screenings annually. There's usually a line out the door to receive them. Adults, sometimes it's the only healthcare people receive all year. From the NP student result perspective, we see that, wow, it really helps their education. Over 90% of our graduates at UTC of nurse practitioners go on to work in medically underserved areas. We know that their confidence is escalated by working at events like this to go on to serve these populations in their profession. So they learn something new from this one-time event. Agree to strongly agree, over half of them. Relevant to your NP education, over 92% agree. Perception of community impact, 74% think it's high or very high, important for the community. And a good to excellent experience for the student, over 80%. Rhonda?
Yeah, and so for the attendees experience, 94% would recommend it, 85% expressed a desire to be healthier, and I love that, 77, which is a perfect number, committed healthier lifestyle change, because 7's a perfect number, right? So 77, all right, go ahead.
Oh, you can go ahead with the attendee.
So 77% of community respondents reported committed to healthier lifestyle. I just thought that was great. We have them for the day and try to show some good opportunities there for healthier lifestyle actions. So hard copies of surveys were made available. More research over time should be conducted. We need to do this more. Next slide.
And for us, we see that it yielded positive self-reported experiences for both the NP students and the community members. And that over 50%, again, shared that they learned something new that they can apply in their future practice just from working at these minority health fairs. and that it has long-term benefits for MP students. It's more than just a volunteer experience of helping the community. It impacts their employment decisions later on and their comfortability in self-efficacy and working with patients. Just some quotes. My eyes were open to the challenges uninsured people face. My health fair experience showed me the joy of helping people prevent chronic disease. I learned how access to care impacts patient outcomes. And just a little more, the fair was an excellent source of health resources for our community, and they requested more events. So conclusions, that these conscientious partnerships are needed, that they're beneficial for the community and for the students both, and that further research is recommended to see how health fair attendance impacts those perceived long-term behavioral changes that they said in Ronda's study they wanted to implement as a result of attending the fair.
And that concludes our presentation. So thank you all.